Autoimmune disease is thought to affect about 1 in 10 people now. And that's not taking into account probably all the undiagnosed cases there are as well. Autoimmune disease seems to be a growing concern, which lends itself to the understanding and the belief that there are many environmental factors at play. And this is why integrative medicine and functional medicine are such good approaches at helping to address the roots of autoimmune disease. Hi, my name's Dr. Anna Forbes. I'm an integrative medicine doctor and founder of the Forbes Clinic of Integrative Medicine. Integrative medicine is about empowering the person to take care of themselves and helping to work with you to address the potential root causes of your condition. So today I'm going to be speaking about autoimmune disease and integrative medicine. Autoimmune disease is when the normal role of the immune system is somewhat disturbed so that the immune system begins attacking healthy tissues. Examples of autoimmune disease include rheumatoid arthritis, type 1 diabetes mellitus, and multiple sclerosis. And there are over 80 autoimmune diseases currently known. Often when people have one autoimmune disease, that puts them at risk of developing other autoimmune diseases. So there is this association, because ultimately the problem with autoimmune disease is that the immune system is dysfunctional. So it makes sense that we have one, we're more likely to have another. Symptoms such as fatigue and pain are common in autoimmune diseases, but also there can be skin issues, muscle problems, weight loss, hair loss, sensitivities as well. So quite a few different symptoms that can occur within the umbrella term of autoimmunity. Symptoms can vary depending on the part of the body that's affected and the type of autoimmune disease. They can also come and go and vary in severity. Autoimmune diseases are much more common in women and run in families. So there is a genetic component as well. But often the contribution of genetics can be actually quite a small percentage. And this can be affected by environmental factors as well. We call this term epigenetics. So what's the integrative medicine approach to managing autoimmune disease? So the integrative medicine approach puts the patient at the center of their own health journey and empowers them to take care of themselves, giving you skills and resources to help you manage yourself better. There is quite a lot of evidence now showing the benefits of lifestyle medicine in autoimmune disease and the associated factors. So, for example, we know that Epstein-Barr virus infection, smoking, sun exposure, vitamin D, and adolescent obesity can increase the risk of multiple sclerosis. And these are aspects we can look at addressing within the realm of integrative medicine. Functional medicine, it's a branch of medicine that is a standalone branch of medicine, but actually within integrative medicine, we often incorporate functional medicine. And in my own practice and at the Forbes Clinic of Integrative Medicine, functional medicine is a really important part of what we do. So whereas integrative medicine is very holistic and looks at all aspects of human health, functional medicine still is very much in the realm of physical medicine, but using natural approaches. Functional medicine is also known as ecological or environmental medicine. And it's an individualized form of medicine which focuses largely on environmental and nutritional factors. And this is really important in autoimmune disease because there's quite a lot of evidence linking the importance of nutrition to the development and management of autoimmune disease. Because we know there's a big inflammatory component often to autoimmune disease, there are nutritional approaches we can take to help reduce inflammation, and this has been shown to be beneficial in autoimmune disease. So nutrition is a really important part of what we do. And whilst research is still limited in this area with regards to linking nutrition and autoimmune disease, those of us working in the field see a really clear association between doing what we call gut healing work and seeing improvements in symptoms in autoimmune disease, which links with the reduction of inflammation. So this is often what we will see when we do that sort of work. As we know, most of the immune system actually lives in the gut. So it makes sense also that we do this gut work to help with the immune system to repair itself as best as possible. I have had several patients over the years who have made good dietary changes and seen significant improvements in their autoimmune symptoms. And I remember one lady who went back to her rheumatologist and said, giving up gluten made such a huge difference to my symptoms. My pain has almost gone. Why didn't you tell me? And the rheumatologist said, look, I know a lot of patients tell me this, but there is just a lack of evidence for it, so I can't recommend it. So sometimes we are very limited in medicine by what research is telling us, and sometimes we do need to look at what our patients are telling us, the experience of our patients, and what we're seeing in clinic. Heavy metal exposure. This has been a widely recognized risk factor for human health for a long time. So when we look at blood cadmium and lead, urinary cadmium, lead, antimony, tungsten, uranium, these were all identified to be positively associated with rheumatoid arthritis risk. So testing for these substances, testing for heavy metals, and then doing some sort of a heavy metal detox program is something that I feel is really important when addressing autoimmune disease using an integrative medicine approach. We also have evidence that certain pathogens are associated with different autoimmune diseases, which we can screen for. So at the Forbes Clinic and in my practice, we screen for those potential pathogens that could be linked, and then we work to address those pathogens where needed. A personal specialty of mine is called microimmunotherapy, and this is where we use plant-derived substances. So it's very gentle, but can be really effective. They are plant-derived immunomodulatory substances, which just gently begin to nudge the immune system back towards its healthy blueprint. So we look at the immune system, we do an immune panel to begin with on the blood, and by looking at the imbalances in the immune system, we can actually work to address these using microimmunotherapy. So for me, this is a really important part of the way that I work with autoimmune disease. The key thing in integrative medicine is we're always looking to try to address the root cause of the issue. And in my experience and the experience of many of my colleagues, the psycho-emotional factors that are part of a person's makeup, often psycho-emotional conflicts, are a really important part of their picture. Now, these, whilst we address them, and we at the Forbes Clinic have a mind-body hub with lots of different therapists that we can select according to who we feel is right for the patient. We do that mind-body work, but it can take time. And there's no guarantee it's going to significantly impact on the autoimmune disease anytime soon. This can be a bit of a life journey. So in the interim, we do that physical work. So even if we know that maybe the root cause may be psycho-emotional, actually doing this physical work using nutrition, detoxification, and from my perspective, microimmunotherapy, this really can help to improve someone's management of their symptoms whilst we do that deeper work. So what is the mind-body medicine approach and why do we use it? So we can see from studies that a significant number of patients with autoimmune disease often have adverse childhood events. So childhood trauma is a strongly positive risk factor for the development of autoimmune disease. In fact, childhood traumatic stress studies have shown it's increased the likelihood of hospitalization with a diagnosed autoimmune disease decades into adulthood. So it is a really important stone to turn over, I always say. And these findings are also consistent with recent biological studies on the impact of early life stress on subsequent inflammatory responses. So again, it's looking at that inflammatory mechanism. And we know, again, from studies and from clinical experience that high psychological distress levels with trauma exposure is associated with elevated inflammation. So what do we do about this in clinic? So in integrative medicine, we really always consider the meaning of disease, what the body is trying to tell us. And by taking this more holistic view, we reduce the stress caused by fear of the illness as we consider ourselves to be working more collaboratively with the body. We are supporting the body to heal. There is no enemy at large, but a learning and a journey of self-communication. So we are not saying don't take medications. We would never say that. We're just saying that there's a lot that you can do for yourself too.